Hi, I'm Sophia Lester, and I'll be explaining the anatomy of a multi-ligament knee injury. Joe Burrow, who's the quarterback for the Cincinnati Bengals, had a significant knee injury in 2020, which is a great example of the complex injury. I'll be using his example to explain how it can happen, how to repair it, and the treatment after surgery. To understand the injury, you need to understand the basic structure of the knee. The knee is a complex hinge joint that attaches the femur to the tibia and allows for the bending and extending motion of the leg. There are four main stabilizing ligaments in the knee. Firstly, the ACL and the PCL cross in opposite directions in the center of the knee and allow for the back-to-back stability of the leg. Next, the MCL and the LCL are found on the sides of the knee and provide side-to-side stability. The knee has two menisci which prevent the femur and the tibia from grinding past each other. Then the quadriceps tendon connects the quad muscle to the patella, which then works with the patellar tendon, which connects the patella to the tibia. Joe Burrow tore his ACL and MCL during a tackle because of the valgus force from the outside of the knee to the inside of the knee, paired with the hyperextension of the knee. Here's a clip of his injury. After his injury, the doctors had to assess the signs and tests to determine what the injury was. Some signs of tears could be a pop, immediate swelling, or inability to put weight on the limb. It's important to get an MRI to see a detailed image of the bones and ligaments. This is an MRI image of a healthy ACL on the left compared to a torn ACL on the right. Using these techniques, doctors determined that Joe Burrow tore his ACL and MCL and had to have a patellar tendon graft on. During his surgery, a hole was drilled through the tibia and the femur. Then the doctor threaded the patellar tendon graft through the holes until the graft was in the knee joint the same orientation as the old ACL. The tendon became the new ligament. The MCL portion of his injury wasn't addressed surgically, but in worst cases, it can be addressed surgically in similar ways to an ACL reconstruction. After surgery, there's an extensive recovery that needs to happen before the athlete can safely return back to the sport. This usually looks like 4 to 6 weeks in a brace non-weight bearing, and then 3 months building up strength in the leg. When you have a surgery like this, there is significant muscle atrophy. To prevent re-tears, muscles need to be built back up to be identical to the non-surgical leg. Then strength tests like a biodex test will be performed to determine if the athlete can return back to running, jumping, and progression back into their sport. Full recovery typically lasts 9 to 12 months. Many athletes say that after the significant injury, their knee is never the same. While this is true, there's many athletes that have great success after their injuries. The year after Joe Burrow's ACL and MCL tear, he led the Bengals to the Super Bowl and was the NFL Comeback Player of the Year.